Hello everyone, today we'll be talking about oxytocin, specifically the role of oxytocin in obstetrics and gynecology. So we'll briefly discuss the pharmacology. So oxytocin is a nonapeptide. It is synthesized in the supraoptic and paraventricular nuclei of the hypothalamus. Then by the nerve axons, it is transported from the hypothalamus to the posterior pituitary, where it is stored and eventually released. Oxytocin has a half-life of 3 to 4 minutes and a duration of action of approximately 20 minutes. It is rapidly metabolized and degraded by oxytocinase. The mode of action of oxytocin is myometrial oxytocin receptor concentration. It increases to its maximum, which is 100 to 200 folds during labor. Oxytocin acts through receptor and voltage-gated mediated calcium channels to initiate myometrial contractions. It stimulates amniotic and decidual prostaglandin production. Bound intracellular calcium is eventually mobilized from the sarcoplasmic reticulum to activate the contractile protein. The uterine contractions are physiological, which cause fundal contraction with relaxation of the cervix. So effectiveness of oxytocin. So in the first trimester, the uterus is almost refractory to oxytocin. In the second trimester, relative refractoriness persists, and as such, oxytocin can only supplement other abortifacient agents in induction of abortion. Then in later months of pregnancy and during labor in particular, it is highly sensitive to oxytocin even in small doses. Then what you need to know is oxytocin loses its effectiveness unless preserved at the correct temperature, between 2 and 8 degrees Celsius. So what are the indications of the use of oxytocin? So in early pregnancy, it's to accelerate abortion inevitable or missed, and to expedite expulsion of hydatidiform mole. 2. To stop bleeding following evacuation of the uterus. 3. It's used as an adjunct to induction of abortion along with other abortifacient agents, which is prostaglandins. Then in late pregnancy, oxytocin is used to induce labor, to ripen the cervix before induction, augmentation of labor, and in uterine inertia. The indication of oxytocin in labor is inactive management of third stage of labor, following expulsion of placenta as an alternative to ergometrin. Then in the puerperium, it's used to minimize blood loss and to control postpartum hemorrhage. Oxytocin can also be used as a diagnostic tool in the contraction stress test and in the oxytocin sensitivity test. Then we need to know if the indications, there are always contraindications of something. Okay, so what are the contraindications of oxytocin? In pregnancy, grand multipara, if there is a contracted pelvis, if there is a history of cesarean section or hysterotomy, in malpresentation. Then contraindications during labor, all the contraindications in pregnancy plus obstructed labor, incoordinate uterine contraction, fetal distress. Then contraindications at any time if the patient is in hypovolemic state and in case if there is any cardiac disease. Then dangers of oxytocin. So maternal is 1. Uterine hyperstimulation or overactivity of the uterus. So this is a frequently observed side effect. It's often associated with abnormal fetal heart rate pattern. Then uterine rupture. This may be seen with violent uterine contractions, which are common. High-risk cases include grand multipara, malpresentation, contracted pelvis, prior uterine scar, which is hysterotomy, and excessive oxytocin use. Then hypotension. So bolus IV injection of oxytocin causes hypotension, especially when patient is hypovolemic or with a heart disease. And occasionally oxytocin may also produce anginal pain. Then antidiuresis. So antidiuretic effect is observed when oxytocin infusion rate is high, which is 40 to 50 milli-international units per minute, and is continued for a long time. Then water intoxication is due to its antidiuretic function when used in high doses, which is 30 to 40 milli-international units per minute. And water intoxication is manifested by hyponatremia, confusion, coma, convulsions, congestive cardiac failure, and death. Then fetal complications include fetal distress, fetal hypoxia, or even fetal death may occur due to uterine hyperstimulation. Then you need to know that uterine hypotonia or polysystole causes reduced placental blood flow. So that's all about oxytocin. If you like the video, please like, subscribe, and comment. Thank you.